This audio was recorded for the Heads and Tails Mental Health Project with Chilli Studios.
I have anxiety disorder, and what I want to do is tell you about anxiety and what it feels like, because I had years of struggling with anxiety, not knowing what was wrong with me, and it was mainly manifested through physical symptoms, chest pains and stomach and indigestion. And I went for all sorts of tests on my heart, and I had tubes down my stomach and everything, and every time they said there was nothing wrong with me. Finally a GP recognised that it was anxiety and depression. But I want people to recognise it in themselves or in their friends or relatives that this is what it is. So there's three sort of areas that I think you suffer from when you've got anxiety disorder, and as I just said, a massive part is physical symptoms, so chest pains, indigestion, feeling really restless, used to get all this tingling in my legs and everything. And then the second part is also a massive thing, is sleep, not being able to sleep, insomnia. When you haven't had a night's sleep, you feel terrible the next day, so it just aggravates everything and makes it a massive problem. And then, of course, there's the psychological and emotional side of it, and the best I can describe it is like a mental distress for no obvious reason. It's like a pain, but it's not a physical pain, but it's in your mind. You're not right. And I did think of a good description is that when you wake up from a nightmare and you feel like dread and fear, it's just like that, but coming on you in the day, like in a wave, a wave's fear and dread, and it's horrible, just for no good reason. And then also negative thoughts about yourself, feeling like you're not good enough and everyone's better than me, and just lack of confidence, and then also you stop enjoying all the things that you normally would enjoy, and that makes you even worse. You're at a sports event or something, and you're thinking, I'm supposed to be really enjoying this, and I'm just feeling terrible, and that makes you even worse. And intrusive thoughts as well, having thoughts that horrible things are going to happen, or you're going to lose control of yourself, and say on a bus or something, you're going to shout some swear words, or and then mood swings as well. This is quite typical, especially with me. I was much worse in the morning, and then as the day goes on, it sort of tails off, and you start feeling better towards the evening. That's supposedly very typical. So in summary, it's not a nice thing. It's difficult to work, as we've already said. Like if your boss is talking to you and you've got all these thoughts, you can't even concentrate on what your boss is telling you to do. It's difficult to enjoy life. However, to finish off, the message I want to get over is that there are ways you can learn to cope and enjoy your life. You might never get rid of it, but you can learn to cope with it. And I went to CBT, which for me, cognitive behavioural therapy, was really useful. And then I've been going to the Newcastle Recovery College, which I've got a great deal of benefit from. And then I'm also on medication, and I've got to the point where I've accepted that I'm going to have to stay on medication. And things like exercise and getting out, having a social life, forcing yourself to go out and meet your friends, and then all the things that, if you can find hobbies that take your mind completely off of your life, then that's really beneficial, like art or sport or go running or whatever. I go to yoga, and I also do mindfulness, and I find they're really useful. So to finish off, there are ways you can get through it and actually enjoy your life despite it.